I thank the Chairman for yielding. You know, I think it's appropriate that we begin the debate on this bill today. Today is the date where the bill was introduced into Congress, where we said we're no longer going to have private student lending. It's now going to be a government function. In the early 1990s, we said very innocently, you know, government is going to provide a public alternative to private lenders. Don't worry, we're going to have public just as an alternative, just as a choice to make sure that we can hold the private sector accountable. Now 15, 16, 17 years later, we understand the real rationale for introducing direct student loans in the early 1990s. It was to shut down the private sector. If you think that this bill is going to be any different, you know, you're kidding yourself. It may be 5 years, it may be 10 years, it may be 15 years, but sometime in the future, the health care that many of Americans want, the health insurance coverage that they appreciate, that's been provided to them, that they know how it works, will be gone. There's no question about whether you will lose the opportunity to choose private sector health care. You will lose that opportunity. It will be eliminated. The only question is, when? We've seen it before, and now we're seeing it again. If you don't believe we're going to see bureaucracy and that the control is going to move away from individuals to Washington, just read the bill. The Commissioner shall specify the benefits. The Commissioner may not enter into a contract. The Commissioner shall establish the following standards. The Commissioner shall establish a permissible range. The Commissioner shall establish standards, shall certify. The Commissioner shall solicit, shall, based upon a review of such bids, shall enter into contracts. The entity shall provide for the reporting of such information as the Commissioner may specify. The Commissioner shall establish. The Commissioner may terminate a contract. The Commissioner determines that such provider network works. And that's all in about 7 or 8 pages of this health care bill. You know, we're moving control from, yes, an imperfect market. Markets don't always work well. There are imperfections. There are sometimes gaps, but markets respond and markets modify, markets adapt, markets involve creativity to solve the needs that are out there. You know, it was 2001 and we established another major government program. You know, we've taken away now, or we're working on taking away the opportunity for the private sector to choose where they will get their student loans. In 2001, we took another opportunity away from the American people. We took away the opportunity for the American people at the local level to control their local public schools. We had a massive shift, a massive transfer of authority from our local parents, our local school boards, our local educational boards, to Washington, D.C. And we now have bureaucrats in Washington, D.C. deciding who's a qualified teacher and what's a qualified school. Shoot, they don't even know where half the schools in America are. I used to go to the Department of Education and ask them, you know, who knows where the schools are in my district? Who knows where Ludington, Michigan is? Who knows where Baldwin is? Who knows where Holland is? Who knows where Muskegon is? Who in the department reads those documents that they send to Washington, D.C. and actually understands the differences in each of those communities? They don't. And now what we're going to see here is who knows Joe, who knows Mary, who knows Bill, what their health care needs are. The bureaucrats in Washington, D.C. won't. The local doctors will. The local nurses in the local hospitals will know about those patients. But when they come to treating that patient, they will no longer be looking at the patient and determining the level of care and the appropriate type of care for that patient. What they're going to be doing is they're going to be looking at a manual that is many times thicker than this and a bureaucrat in Washington, D.C. will outline for them the type of treatment that this patient will get, and it will be an anonymous bureaucrat that will make those health care decisions for those individuals. With that, Mr. Chairman, I yield back the balance of my time.